Well, Mother's Day left many of us thinking about our special bond with Mom, but for one mother-daughter duo, that bond went to an extreme most of us would never before even consider.
Yes, together they made a dramatic decision to fight fate. CBS 2's Dr. Holly Phillips here now with their story.
Sure, Christine, we're actually talking about their fight against ovarian cancer. The illness strikes about 25,000 American women every year, far too many. But some women have an especially high risk of getting the disease. And one mother and daughter took dramatic steps to prevent it.
How are you feeling, sweetheart?
Talk about sharing a momentous occasion. Mother and daughter, hours after having their ovaries removed. Operations on the same day, same hospital.
We do everything together.
A lifetime of happy memories with the family. But they also share a difficult medical history. 62-year-old Christina Hindman was the first to be diagnosed with breast cancer. That was 10 years ago. Then last year, it struck her daughter, Ann Vogt, who was 39.
When Ann's diagnosis came, that was the worst day of my life.
They both had bilateral mastectomies. Vogt's cancer was more aggressive. She had radiation and chemotherapy. Then genetic testing with a simple blood test showed they carried the breast and ovarian cancer gene, BRCA2.
They have a risk of ovarian cancer somewhere between 30 and 45% over their life, which is extremely high.
Dr. Thomas Randall says there's no easy way to screen for ovarian cancer. So prophylactic surgery is often a good option. That means taking out the ovaries before cancer strikes.
Removing the ovaries in a woman who has a BRCA mutation reduces the risk of ovarian cancer by about 90%.
There was no hesitation on either of our parts.
I needed to be here for my child and whatever I can do to increase my odds.
Thankfully, Vogt was finished having children, so losing her ovaries wasn't a problem.
You too. Thanks for taking care of me.
You're the best.
Now that their cancer risk is reduced, they worry about Vogt's 12-year-old daughter, who also might have the gene.
Oh, it's terrifying. Yeah, it's absolutely terrifying.
The symptoms of ovarian cancer are subtle and include sudden abdominal bloating, a loss of appetite, and the need to urinate often. If you have breast or ovarian cancer in your family, you should talk to your doctor because you might need to be screened for the illnesses more frequently than others. And in other health news today, they're some of the most commonly prescribed medications for acid reflux and ulcers. But a new study shows that proton pump inhibitors, such as Prevacid and Nexium, can cause bone fractures, kidney disease, and bacterial infections in some patients.
They can change the bacteria that live in your body and therefore possibly predispose you to an infection that causes fever, abdominal pain, diarrhea, and sometimes death.
The study appeared today in the Archives of Internal Medicine. More than 110 million prescriptions are filled every year for the drugs. Now, researchers point out that most people who take the medication don't experience these serious side effects. But it is just a reminder, there are no quick fixes. If we can use diet and exercise to help overcome acid reflux, it's, of course, better than the medications.
Dr. Holly Phillips, thank you.
Sure.